Welcome back at 7:16. It's that time of year again to start re-examining our health insurance coverage. Medicare's annual enrollment period is underway. If you want to change your Medicare coverage for 2024, this is the time to do so. Dr. Brent Wallis from People's Health is with us this morning to discuss the annual enrollment period and different kinds of Medicare plans. Dr. Wallis, good morning. Thanks for being with us.
Good morning. Thanks for having me.
So I think the biggest question that people need answered right now, I mentioned that the enrollment period is open, but how long does it last?
Yeah, so annual enrollment, or we call it AEP, actually runs from right now. It started on October 15th and it runs until December 7th. And this is really a critical time for anyone who is Medicare eligible because it's the opportunity to look at what coverage they have and really what coverage they're going to need beginning in January.
And what kind of changes, as I mentioned, this is the time to make changes if you need to. What kind of changes would you need to or possibly want to make to your plan if you already have that coverage?
Yeah, you want to actually look at, does your plan cover what you need? Is it covering what you need right now? And do you need to switch to a different plan? So if you're on original Medicare, you have the option to choose a new Part D drug plan. Or a Medicare Advantage plan. And if you're on Medicare Advantage already, you have the opportunity to shop around for other plans that may have additional benefits that you could use.
And people often hear, I know commercials all the time about Medicare coverage, and they might hear original versus Medicare Advantage. Explain the difference between the two if you can.
Yeah, sure. So original Medicare is, it's a plan that's administered by the federal government, whereas Medicare Advantage plans are administered by private insurance companies. And, they both cover medically necessary problems that you may need assistance with in a physician's office or in a hospital or maybe even from a facility like home health or a skilled nursing facility. The biggest difference is that Medicare, original Medicare, does not cover Part D prescription drugs, and it doesn't cover any of those special benefits like vision, hearing, or dental, whereas Medicare Advantage plans often have those extra benefits included in them.
So just to know which one you need, you kind of just need to look at what medications you're on, what ailments you might have, and that will kind of help you decide which direction to go in. Is that right?
Yeah, absolutely. You want to take a look at what your needs are going to be for the next year. Look at the plan and make sure that your doctors are covered, that your prescription drugs are covered. And if you are considering a Medicare Advantage plan, would you actually use those extra benefits? Do you need vision? Do you need dental or hearing? Or a gym membership, perhaps? Would you use those? Because you don't want to take a benefit that you're never going to use.
Dr. Wallis, we're out of time, but really quickly, where can people go for assistance getting enrolled, re-enrolled in this program? I know some people aren't tech savvy, so how can they get the help they need?
Yeah, they can actually go to Medicare.gov and look up a lot of information about plans, or they could come to our website at peopleshealth.com, and all this information and more is in there.
And of course, they can find out where they can come to get in-person help, if that's something they should need as well, I would imagine.
Yeah, absolutely. We've got a Medicare center right next to Party City on Veterans, and they're welcome to come in and talk with us.
All right, Dr. Wallis, as always, we appreciate your time.
Thank you. Have a great weekend.